Welcome to Talking the Whiz Quiz, an HR guide to drug and alcohol testing. I am Lori Oshman.
And I'm Gary Oshman.
And today we're here to talk to you about the medical review officer process when it comes to drug testing. We have a very special guest today, Dr. Scott Krasner. Here's a little background of him. After graduating medical school in Wisconsin in 1983, Dr. Krasner went through 2 residencies, first in obstetrics and gynecology, and then in occupational medicine. He continued to practice occupational medicine in Tucson, becoming medical director of several occupational clinics and medical centers, and then now has a Krasner Medical Consultants. Dr. Krasner is board certified in occupational medicine and is a fellow of the American College of Occupational Environmental Medicine. He is certified independent medical examiner and certified in forensic medicine. He has been breath alcohol technician and instructor and a certified medical review officer since the drug testing programs were established, and is a clinical associate professor at the University of Arizona College of Medicine. So I would like to introduce Dr. Krasner.
Thank you very much for inviting me to be here.
I have personally known Dr. Krasner probably for over 30 years, and he's been our medical review officer. We're going to talk about really what is the MRO. What a medical review officer is and what the MRO process is. So if you could let us know, what is a medical review officer?
A medical review officer is a licensed physician who has experience and expertise in drugs of abuse, in the drug testing process, and in interpreting the results of a drug test to determine if it's positive or negative for abuse or if there are problems.
So what are some of the requirements to become a certified medical review officer?
One has to be a licensed physician and has to take a training course in medical review officer and drug testing, and develop proficiency by passing a national certifying exam and maintain continuing education.
And I do know, like I said, you do have a medical review officer assistant who helps with all, several of the roles. That way you're not having to review every test personally. But what are the types of tests you do have to, a medical review officer does have to review personally?
My MRO assistant reviews all the negatives, but as the certifying medical review officer, I review the non-negatives, which means the positive drug tests, the refusals, the invalid drug tests, any problems with that. In addition, I spot check my assistant by reviewing at least 5% of the negatives to make sure that it is performed accurately.
So what is the MRO process? What are the steps that have to be done once the laboratory reports the results to you?
First of all, I review the chain of custody control form to ensure that it is accurate. Then I review the laboratory results to, again, ensure that it's accurate and it's valid. If something shows up on the laboratory, then I call the donor to determine if there is a legitimate medical explanation, such as a prescription that can be documented. If there is a legitimate medical explanation that's documented, I will report it as negative, meaning negative for abuse. But if there is no legitimate medical explanation, I report it as positive, meaning it's positive for abuse. I also discuss with the donor the ability to take it out of frozen storage and test it at another lab for the 5th or 6th time. I then entertain any and all questions that the donor may have.
So on that, where the person has to show that they have a prescription medication, what do they need to show you?
I will accept documentation of a prescription, meaning the bottle. I will accept documentation from the pharmacy or from their treating doctor or a hospital. Anything that we can document in writing gets sent to me. I just don't accept what the patient or the donor tells me at their word.
So when you're reviewing a prescription, what are you looking for in that prescription or medication that that person is taking?
I'm looking for accuracy. I'm looking for that it was prescribed for that patient or donor. I'm looking for the name and phone number of the pharmacy and of the doctor. And I'm also looking to see if that prescription will explain the results. For example, if a person is positive for methamphetamine, which can be a prescription medication, and if a person shows me a prescription for amphetamine itself, although that's a legitimate prescription, that's not acceptable because amphetamine will not metabolize into methamphetamine.
And the federal government mandates the use of a medical review officer for all federal tests. That's Department of Health and Human Services regulated, which is the employees of the federal government, of the government, but also all the U.S. Department of Transportation employees. But why is it important that a company utilize a medical review officer for non-regulated drug testing, where it's not always mandated under state law?
The bulk of the drug testing process are the non-regulated. And in those cases, there are no regulations. So the company can do as they please and review the drug tests from the lab, but they hold the liability that if they terminate somebody or make an administrative decision because there's a legitimate medical reason, that can lead to a wrongful termination. If they were to ask for documentation, that will lead to a HIPAA violation. So in order to protect companies that fall under the non-regulated drug testing process, it's advisable to use a certified medical review officer so that the MRO can determine if there's a legitimate medical explanation. Let me give you an example. Suppose a person had a drug test that's positive for cocaine. And if the company does not use a medical review officer, they may terminate somebody because obviously cocaine is a drug of abuse. However, we do use cocaine legitimately in the medical profession. For example, it is an anesthetic for certain types of surgeries. The company cannot obtain that HIPAA-protected information. So by using a certified medical review officer, I can document whether or not there is a legitimate medical explanation, and that protects the company from any liability.
Perfect.
I think that it's kind of a question that comes up in that collection process. A lot of times a donor will say, hey, I have some prescriptions I want to tell you about. And again, in that protecting different people at different parts of that testing process is the collector can't or shouldn't know what medications a person is taking because they aren't professionals. They don't know what those drugs mean or how they may affect, or even if they would show up on the test. So, I mean, at that collector process or stage, we're oftentimes telling them, you could write them down on the back of essentially your form, or wait, and if the doctor reaches out to you, have that information available for them.
Exactly. It is not the role of the collector to interpret or make such medical decisions as to whether or not they have a prescription. So let the collector collect the specimen, and if a donor talks about the medications that they use, the collector can reply exactly as you said, that write it down so that should the medical review officer call, you will have that in your memory.
Right.
And we run into that all the time, in the collection process. And really, it is the collector is not a medical professional. It really has, under HIPAA, really has no right to know what that person is taking.
Right. And
all.
as Dr. Krasner said, it is also the employer has no right to know what medication an employee is taking.
And the majority of prescription medications are not going to show up on most drug screens because they're not going to necessarily affect the safety sensitive ability of that.
That is correct. And although donors will oftentimes volunteer to the collector that information, and it is best that the collector advises them to just write it down so that should the MRO call you, the donor will have that fresh in their memory and we can document prescription.
I know I've had several times in the past where a donor literally would bring in a whole paper bag full of all their medications, and we're like, yeah, just keep those in that bag. We do not want to see them. The medical review officer will be reaching out to you if anything does show up, and this is why we put your contact information, your phone number, possibly your email address on the chain of custody form. That way the medical review officer can have the ability to reach out to you.
And we've really emphasized to collectors now too is if people are volunteering information, tell them, answer your phone when you get that call that you don't recognize the number, because it's probably the medical review officer and they need to speak with you. Because I know that is an issue you've been running into is, even in this day and age, people won't answer their phone if they don't recognize the phone number.
That happens very often, that if something shows up on a drug test, the medical review officer will contact a person. Sometimes, and especially in today's day and age, where people are concerned about scam artists and spam calls, they will not answer. And since as the medical review officer, if I cannot contact them and document a legitimate prescription, I have no choice but to report it as positive. And then they may be terminated. They may lose their source of income, their benefits, they can't pay their mortgage. However, I must point out that if they do later call me and we can document a legitimate prescription, I can revise my report from positive to a negative as long as we can document a legitimate medical reason for the test.
I know you've been doing this for many years, so I'm sure, I've heard many people give us some interesting stories of why they have tested positive or why a certain medication, prescription, or drug is in their system. What are some of those most memorable excuses that donor has provided you of why they've tested positive?
One story comes to mind is a person whose drug test was positive for methadone. And I contacted him and he got very mad. He slammed his hand down and said, "I'm going to sue you because I know methadone is legitimate. And the reason why I know is because my brother does methadone." To which I replied, "Well, let me see if I get this straight. You say that your brother takes methadone. You say you do not take methadone. The drug test is positive for methadone. And I'm reviewing the paperwork and the signatures don't match. By any chance, did your brother take the drug test for you?" Dead silence.
And I know even there's, like I said, there's even been, some people have literally threatened you at times because, they are just in denial of it. I think I remember one case, where the gentleman just literally for years kept calling, saying, "Hey, this was not, there's no way this, I could have tested positive for cocaine." And it's like, okay, by the amount of time you've taken to do all of this, you could have gone through the entire SAP, return to duty process, been back to work, instead of just, denying it for years. I think that was even a case where we sent in that split bottle B, it be confirmed as positive. It's just, but yeah, sometimes you get a few wackadoos out there that we're dealing with.
Exactly. We find that in the certain drugs of abuse have a high degree of denial. And in fact, one of the most important things before one can be treated for drugs of abuse is to acknowledge. And they're in such a state of denial that they will argue, scream, intimidate. That's another reason why to use a medical review officer, because oftentimes they can be so belligerent they can intimidate the company. I've had people that threaten. I've had people who filed complaints with my licensing agency, and all I have to do is show the documentation. Remember, we have the federal government who has been regulating certain types of drug tests. So we have the feds behind us in the accuracy of the drug tests.
And I think that goes back to, too, is you've gone through certification. You have education. An MRO is required to go through a certain amount of education on reviewing drug tests and how that, how you respond and all of those things.
Exactly. In addition to the initial certifying process, the MRO must keep up with continuing education, recertification. So I've been certified for about 35 years, and I've gone through numerous. The drug testing process has changed over the course of time. We now have problems with fentanyl and with oxycodone. And so the drug testing process, we are now doing oral fluid testing in addition to urine testing. So the medical review officer must keep up with the latest advances with continuing education.
And also, I think the other part in the testing process is the labs, making sure you're using a good accredited laboratory in the whole process, because that's where the accuracy of the result comes. Because especially the SAMHSA certified laboratories, they are so highly regulated. These test results are very accurate of this substance was in that person's system, and they're testing for the metabolite of the drugs, which is showing use, not that where somebody can't just put sprinkle some cocaine in a urine sample and it's going to test positive for cocaine. Somebody actually had to consume that drug for it to test positive. And also, so the laboratories are giving us some very accurate results, which is also, like, even with rapid testing, why it's important that everything be,
that non-negatives are sent to the lab for that confirmation. For sure.
Exactly. There's an old saying, you get what you pay for. There are simple screening tests that are inexpensive, but they're screening tests. They're designed not to be accurate. There are other labs that run full testing, but they're not certified by the federal government. By using federally regulated drug tests, typically it's the specimen is tested 3 or 4 times, initially as a screening, and then later on to confirm on a molecular level. And even with that, the results then get sent to the medical review officer to again review for accuracy and whether or not there's a legitimate reason. One of the roles that I play is to ensure the accuracy of the paperwork and the drug testing process. And if it is not accurate, for example, if there is any leakage or if there are no signatures or the specimen ID number on the specimen vial does not match with the chain of custody, then as the medical review officer, I can cancel that because we cannot ensure the accuracy.
Is there any other reasons you would cancel a test?
If there are flaws, I would cancel the test. If there's any other reason that I cannot ensure that that is an accurate specimen, I can cancel the test.
So when you mention flaws, what does that mean?
Typically, the laboratory will check the paperwork to see if there are any flaws or errors. And there are two types. There are fatal flaws, and then there are correctable flaws. Fatal flaws is where if the label or the seal is broken, that can't be corrected. That's a fatal flaw. Or if the ID numbers don't match, or if there's leakage. Then there are correctable flaws where somebody puts the wrong date, they're off by a day, or if the collector did not sign one of the pages. The lab can go back to the collector and to get an affidavit or memorandum of correction to identify. Those are correctable flaws. But if that can't be corrected, and we cannot ensure the accuracy, then the best thing is we will cancel the test and oftentimes recommend a retest.
And sometimes the labs report a result saying it's an invalid result. What does, help people understand what is an invalid result?
Before the lab tests for drugs of abuse, the lab checks for validity to make sure that that specimen is indeed an appropriate urine specimen and it meets parameters. So they typically test for specific gravity, pH, and creatinine. Remember, when a donor provides a urine specimen, they're often in the privacy of a bathroom. And who knows what an unscrupulous person can put into that urine. So the laboratory will check to see if it meets the parameters for urine, then it's valid. If it doesn't meet the parameters, like the pH is too high, or if it's been substituted, then it becomes invalid and it's not even tested.
And I know one of the questions that we get often from employers is when they get a result back and it says this is a diluted specimen. What does a diluted test mean?
Well, you have to keep in mind that not only does the kidney filter out drugs from your system, the kidney will either filter out excess water or reabsorb water depending upon your hydration status. The laboratory, when testing for drugs, uses a cutoff level in the urine concentration. And if it's below that cutoff level, the results are considered negative. If it's above, it's considered positive. Now, theoretically, it's possible that if somebody overly hydrates themselves, there may be drugs in their urine, but because it's below the cutoff level, because the person is overly hydrated, it will be considered negative. So the laboratory may report as negative, but will identify that it's diluted. If it's a simple dilution, then the company may either accept it as negative or recommend a retest. But there's a situation where it is so dilute, what we call super dilution, in which case the medical review officer will not just recommend, but will require a retest.
And one of the other results sometimes we see is a test coming back saying it's adulterated. What does adulterated test mean?
Well, as I explained before, a donor will go into the privacy of a bathroom to provide a urine specimen. Some unscrupulous people may try to add something into the urine that will affect the drug test itself. And there are things in the out in the market where you can try to add to it. And if the laboratory can identify that, for example, chromium or other substances, pineapple juice, which is very acidic, then the laboratory will report as that specimen is adulterated. In other words, it's not pure urine, in which case it will be reported as a refusal because it's been adulterated. It's a refusal to provide a urine, and that should be treated just like a positive.
And what is your process as the medical review officer in those situations? Are you talking with that donor and trying to understand what happened in the process, or does it just simply get reported out?
Yes, I use the same process where I first will review the chain of custody and control form. Secondly, I will review the laboratory. Sometimes I will actually call the laboratory to get more information as to what occurred. Based on that information, I will contact the donor, obtain some medical information to see if there really is a legitimate reason. And if it's adulterated, the answer is no, there's no legitimate. But I still go through the same process. So I treat everybody exactly the same, and then I give them the results. And then I entertain any and all questions.
Okay.
And sometimes we also even get ones that even come back and say, that a determination that the specimen was substituted, which is really, kind of explaining what is considered a substituted test. I think it's pretty obvious, but.
Yes, substituted is similar to adulterated in the sense that the specimen that was provided is not urine, and adulterated implies that something was added. A substituted implies that something else other than urine was provided. Remember, the person goes in the privacy of the bathroom by himself or herself, and sometimes they may have something in their pants or in their socks. Sometimes it's water. Pineapple juice oftentimes looks like urine because of its color, but the acidity or pH is different. There's no creatinine, in which they actually substituted urine for that specimen. It's reviewed, and it will report it as refusal because it's refused to provide a urine specimen and should be treated just like a positive.
Yeah, I think I've even seen a few results come back that were suspected to be animal, not human.
You'd be surprised as to what people will hide in their pants or in their socks.
I still sometimes, it's like, okay, how did you get your dog to provide a specimen for you? But,
No comment there.
Now, sometimes we get a result back, it's, that you report it out as a negative, but you're also recommending that a safety sensitive, if the person's performing safety sensitive duties, they have some type of restriction on them. Why would you do that?
The report of positive or negative means that it's either positive for abuse or negative for abuse. If a person has a medication prescription that's been documented, it will be reported as negative, meaning negative for abuse. But there are certain medications, even though they're completely legal and completely legitimate, may affect their safety position. For example, if somebody is taking a narcotic, which directly affects their mentation, their cognition, and their job is an airplane pilot or an air traffic controller. Even though it's legit and will be reported as negative, we have an obligation to report that they should be restricted from any safety-sensitive position. So that would be a comment that the medical review officer would make, that it's negative, meaning negative for abuse, but they should be restricted from any safety-sensitive activities.
And I know sometimes the recommendation with that is that you have to have the person perform a fitness for duty exam, to show that they really are, safe or not. What is a fitness for duty exam, and what is that process?
The medical review officer cannot determine by a telephonic conference call whether or not a person is safe to perform their duties of their occupation, even though it may be negative for abuse because they have a legitimate prescription. So in cases like that, the medical review officer will report the results as considered negative. However, there may be a safety issue due to medication usage and would recommend a fitness for duty evaluation, which is typically a face-to-face evaluation by a licensed practitioner practitioner to make sure that the person is fit or safe to perform the duties of their occupation, even with that legitimate medication.
Is there certain types of doctors that should be performing that fitness for duty exam over others? I think generally, like, we will recommend that they go to like somebody like yourself that's an occupational license from occupational medicine versus their general physician.
I think what's important is not necessarily their board certification or what kind of background the physician has, but what I think is important is whether that physician has knowledge and skills to identify drugs of abuse and the effects of those drugs or medications on the type of job that they will be performing. So a licensed physician who is especially knowledgeable about the types of drugs as well as the type of job is best suited to ensure that they're safe.
I think it's important, interesting for you to say, you're really looking at drugs of abuse. So it's not about just is it positive or negative, but are they taking a drug in an abusive manner? And can you explain a little bit? I mean, I know we hear stories sometimes of, oh, well, I took my son's leftover cough medicine with codeine in it. Why would that be considered a positive test, whereas if that prescription was in my name, it would not?
Yes. The initial role of the medical review officer is to determine if there is positive for abuse. We define abuse of either illegal use of drugs or use of illegal drugs. So if a person is taking cocaine and has no legitimate medical explanation, that's abuse. That's illegal drugs, or methamphetamine without a prescription. But it's also illegal use of drugs. Much of these drugs are controlled substances. And the whole reason why they are controlled substances is so that the medical community can help to control the dosage level, the prescription for it. So one cannot take their family member's controlled substance without the express permission and direction of a licensed physician, because we know that there could be some side effects. So positive for abuse means either illegal use of drugs or use of illegal drugs. And that's why we would consider taking a family member's prescription illegal use.
Would the same be said for taking a prescription from something that happened years ago, but you still have that medication in your cabinet? It's not for a current ailment.
Well, you're absolutely right. One would think that if it's an old prescription, it may be out of dated. However, under the regulated system, the federal government does not really worry about how old that prescription is. However, the medical review officer should help document, even though it may be 10, 15 years old, that a licensed physician gives permission for current use of that.
Thank you for being here today. I think we all learned a lot about the MRO process, which is very important, in the entire drug testing environment.
Right. We've talked a lot in previous about that whole process, starting from, asking an employee to be tested to, the collection process, the laboratory, and, that final step is we have a result, and I think it's important to know that it is being reviewed by a medical professional who is making sure that the integrity of those results matches what has happened with that donor. Making sure that if they have a legitimate prescription and are taking medications for ailments, that it is documented and is reflected in that result.
So we thank you all for joining us today, and we look forward to you joining us for our next episode.
Thank you for inviting me.
Thank you, Dr. Krasner.